Hello there, and welcome to DNA Decode, where we explore the pathophysiology of genetic disorders. Today's topic is DiGeorge syndrome. First, what causes DiGeorge syndrome? DiGeorge syndrome, also known as the 22q11.2 deletion syndrome, is an autosomal dominant disorder caused by the deletion of a small section in the long arm of chromosome 22. It often occurs spontaneously as a new mutation or inherited as an autosomal dominant disorder. So if one parent has an affected allele, offspring have a 50% chance of inheriting it. The microdeletion chromosome 22 mutates an important gene known as the transcription box factor 1 gene, or TBX1, which codes for a protein that ensures the optimal development of the thymus, parathyroid gland, heart, and facial structure. A mutation in this gene causes implication described by the acronym CASH22. C for cardiac defects, A for abnormal facial features, T for thymus hypoplasia, which is the underdevelopment of the thymus, C for cleft palate, H for hypocalcemia, and 22 as this is the chromosome affected. Firstly, DiGeorge syndrome leads to immunodeficiency due to the lack of or underdevelopment of the thymus gland, interrupting normal T-cell production. T-cells aid in destroying foreign pathogens and real cancer cells in the body and helps in the adaptive immunity response to remember pathogens. If levels are low, the body will be susceptible to recurrent infections. Another characteristic of DiGeorge syndrome is congenital heart disease, which manifests as a ventricular septal defect. This is when individuals are born with a hole in the heart between the left and right ventricles. The size of the hole varies, but if it's big enough, it can cause fluid buildup in the lungs and reduce oxygen-rich blood flow, which can be fatal, causing heart failure. Finally, due to the hypoplasia or underdevelopment of the parathyroid gland, parathyroid hormone levels are low, which prevents calcium from being released from the bones when calcium levels are low in the blood. This is called hypocalcemia, and it can cause muscle spasms and seizures. Some individuals with DiGeorge syndrome may have a characteristic facial features of small, low-set ears, long face, and cleft palate, which can make it difficult to breathe and chew and cause speech difficulties. It also leads to developmental delays in learning and is linked to disorders such as autism, ADHD, depression, and even schizophrenia. A misunderstanding is that all individuals with DiGeorge syndrome have the same symptoms and features. This is not true because it presents on a spectrum from complete DiGeorge syndrome where there's no thymus gland to partial, which can often go undiagnosed. Another misconception is that lifestyle factors of the parents can determine the presence of the condition. However, this is false because this deletion is random and therefore unpredictable. I hope you learned something today. Thanks for tuning in to DNA Decode.
Created using Powtoon.